Hello, and thank you for tuning in to Safety First, our Facebook Live series about keeping you and our community safe and healthy as we navigate this new normal. I'm Elizabeth Van Camp, and I'm a member of the University of Iowa Hospitals and Clinics Healthcare social media team. I'm joined by hospital epidemiologist and infectious disease expert, Dr. Jorge Salinas, who will be answering your questions about the still present risks of COVID-19. So please submit your questions or concerns you have now, and we'll answer as many of them as we can throughout this live. Thanks for joining us today, Dr. Salinas.
Glad to be here today.
One note before we begin is this video is for informational purposes only. If you feel sick or concerned about your health, we encourage you to contact your primary healthcare provider or schedule a video visit to speak to a provider. So Dr. Salinas, this is our first Facebook Live together. Can you give us a little bit of your background and tell us a little bit about what you do as an epidemiologist?
Absolutely. So I'm an infectious diseases doctor, so trained in internal medicine and infectious diseases with yet another specialization in epidemiology at the CDC. So here at the University of Iowa Hospitals and Clinics, I am the hospital epidemiologist. So I oversee a team of nearly 10 people that develop protocols to ensure that our patients and our staff are safe from the risk of healthcare-associated infections.
Great. So there are a number of trends and numbers out there that a person could be watching to monitor the progression of COVID-19. But in your opinion, what is the best data to watch for the general public so that people can stay informed on what is happening with the pandemic?
Absolutely. I agree. There's a lot of information out there. And there is this saying in public health that says that all public health is local. So what you want to look at is what's happening, the trends in your city or in your county. If you look at the national trends, the numbers may appear to be going down, but that may not be the situation in your state or your county. So always try to look for the data affecting your region. The Iowa Department of Public Health and the state of Iowa have a webpage called coronavirus.iowa.gov that contains more information that you would ever want. And but the good thing is that you can drill to your county and see what's happening there. The New York Times also has very nice data visualization tools to assess how the epidemic is evolving in Iowa and each county.
Yeah, and I just saw that Stat News, which is a scientific website, and they have a tracker as well that you can drill down to the nation, state, county, and then you can look at different. Like today, I just looked up the 5-day trend for the Quad Cities because that's where I live, and so there are a lot of really nice resources out there that have accurate information, right?
Correct. Yes, all of them are accurate. What is interesting in the field of epidemiology and data visualization is that data and the message that you obtain from the data, so the information, varies depending on how it's presented to you. So if you're very interested in looking at trends and getting an accurate depiction, you may want to look at more than one source.
That's a good point. Do you mind touching on where Johnson County numbers are, since we're talking about, look specifically there? Where is Johnson County right now?
So interestingly, well, this epidemic doesn't let us sleep well. Every day it changes. Whenever you think that there is a new normal, and that new normal changes. And unfortunately, many parts of the country and parts of Iowa as well are seeing a resurgence, an increase in cases. Even though Johnson County did tremendously well in the number of cases, detecting less than 10 a day cases or so, nowadays Johnson County is reporting between 50 and 100 positive cases a day. So that is concerning because this has occurred at the same time that we have relaxed some of our regulations, some of our practices. We are all, after a long winter, we've all wanted to be out and about and visit friends and family and go on vacation. But the unfortunate reality is that the virus doesn't care if you're on vacation or whether it's summer or not. And it has caught us a bit off guard. And there has been more transmission than we would have expected in Johnson County. But I'm still optimistic that there are things that we can do to limit these increasing cases and bring it down again.
Yeah. So on that same topic, how much more prepared are we now for this sort of resurgence than we were when the virus first really presented itself back in March?
Much better prepared. First of all, we have much more information about the ways the virus presents itself, the symptoms or the lack of symptoms that can come with infection. We now know of some effective treatments that work against the disease. We know more about epidemiology, about the way it's transmitted. And on the other hand, we also have better tools to fight back. One of the best tools is testing. The strategy is identifying, testing, and isolating individuals. So now Iowa has robust testing capacity, and because of that, if we pair the testing capacity with contact tracing and isolation, it is possible to bring the numbers down again. So we're much better prepared. It doesn't mean that it's easy. There is a lot of cooperation. So the name of the game against a pandemic is solidarity. If we all work together as a pack, our chances of winning are much higher than if we take an individualistic approach to the response.
Yeah, well, that touches on my next question for you, which is, so many people are burnt out. As you mentioned, it's summer. They just want to be able to go hang out with their family or friends, or they want to go to a restaurant. They just want to be outside of their own homes. And I think you and I both understand that too. This is a difficult thing. This is something we're not used to having to do. But as we all try to work together so that we can get through this and come out on the other side of the pandemic, what are the ways that people can remain safe while also still kind of going about their lives?
Correct. So we've learned that physical distancing is helpful. I mean, you can see people, just need to stay away a bit, at least 6 feet apart. Frequent hand hygiene, using a form of face covering. There are now so many kinds of face coverings that there is virtually an alternative for every need. You can even self-express using your face coverings. So we can do those things. Something else that we've learned since March is that this virus transmits much better indoors than outdoors. So we can take advantage of this nice summer weather and meet our friends and family in a responsible way in small groups. But if you do it outdoors, the risk to you is much lower.
Great. And so are the recommendations for gathering in groups still try to keep it under 10, or is there any new guidelines for that for outdoor gatherings?
Correct. So I would still try to limit the number of people that I meet outdoors to my inner family or my inner group, my close friends. Some countries and other cities are using this concept of bubbles. The bubble, or a small social bubble, your close friends or neighbors, you hang out with them. And if everybody does that in small groups, that can allow for socialization and still decrease the possibility of spread of the disease. But again, small groups, ideally people that you live with or that you spend a lot of time with, are probably your best bet.
Great. Thank you for that information. That's, I think, super helpful as we get into the summer months. So one of the big concerns about people not wearing face coverings and maybe gathering in large groups or maybe even going to restaurants and bars where they're close together is asymptomatic spread. Because if you don't know you have it and then you go in groups, you're putting others at risk. What do we know now about asymptomatic spread?
We now know that it plays a significant role in transmission of COVID. It's very interesting. Now we know that COVID can, and that's why it's so effective and how it has gone throughout the world so quickly in 6 months or so. Mm-hmm. The peak of transmission is likely very early in the infection, before symptoms start or when symptoms are very mild still, in a way that the symptoms may not prevent you from going to work or even to a party. It may be a mild scratchy throat, a mild headache. Sometimes it's difficulty with smell or taste, but otherwise you may feel okay. So at that time is when you may be the most infectious. So right now it is, again, in our strategy to attack this as a pack, mm-hmm. It is in our best advantage for all of us to assume that we may be infected and to wear a face covering, mm-hmm. so we prevent the spread of our small droplets from going to other people. So that's why most countries and states that have been able to successfully control this epidemic are those that have implemented some form of mass face covering.
Great. Well, if you're just joining us, we're here with Dr. Jorge Salinas, an infectious diseases expert here at UI Hospitals and Clinics, talking about your health and safety during COVID-19. Please comment with any questions you have, and we'll get to as many as we can. So our next question is a personal one. How has your life changed since the pandemic began?
A lot, like most humans around Earth. I've been studying this disease, and that's virtually all I work on. And my work is virtually 24/7, thinking about this, thinking of ways of making our hospitals and clinics safer and as safe as possible for everybody, for patients, visitors, employees. So it's been interesting. Also, I have family abroad, and I have colleagues. Many of my colleagues that we went to medical school together live in Europe, and I have frequent calls with them, and I learned of the tricks or the things that they're doing to improve patient outcomes, to prevent infections, etc. So yes, hyper aware of COVID. That can be detrimental. So to some people, it has not been for me necessarily. I try my best to unplug, especially over the weekends. But yes, there is the risk for information overload. But yeah, my life has changed. I study a lot. I read a lot about this. Talk a lot about COVID. But I love the summer. The summer is great, and I spend a lot of time with my children in the backyard, and that gives me a lot of peace.
Yeah, I've been taking a lot of solace in being outside as well. We've got a pollinator garden that I started last year, and so I'm having a lot of fun watching the bees and the butterflies come. And while I'm looking at the flowers, I'm not thinking about COVID-19, which is a nice break. So,
correct. So exactly. So we don't want to. I guess it's like riding a bike. You know how to do it, even though you don't think about it. So it should be the same thing for the way we approach life. Nowadays, while we don't necessarily have to think of COVID every minute, our actions, our behaviors should be influenced by it. We should always maintain social distancing. We should always, when we're leaving the house, we should have a face covering in our pocket, in case you may need it, in case you want to stop by the store. So, yes.
Yeah, I agree. It's a whole shift in how we go about daily life. It really is like we have to have a new normal. We can still have what our life was. It's just a little different. It's a little altered. I've started keeping a face mask or my face shield in my car because you're right. Sometimes I run an errand and I want to make sure that I'm safe. But that has taken conscious effort to remind myself, oh yeah, I want to protect others that are at the store as well. So I need to remember to bring that with me. Just
I
take
think
that
it's
little extra thought.
I think it's a good idea to have more than one mask. For example, I always keep one in my car in case I forget. I have one in my office, one at home. So there are ways, very easy to do, and eventually you just stop thinking about it.
Yeah.
Which is great. You know, another way to not have to think about your face coverings are face shields.
Mm-hmm.
Once you have them on, after a while you forget about it. Many times I've spilled coffee because I thought that I didn't have one on. So again, there are just so many options
Yes.
for a face covering that is non-intrusive, that you can wear for long hours.
Mm-hmm.
Even if you have difficulty breathing, there are ways.
Yeah. I agree. My face shield has been a game changer. I forget it's on and it's so much more convenient, and I feel like I can interact with people in a way I can't with a face mask on. So it's a nice alternative.
Correct.
So there's several questions coming in through Facebook. So I want to get to some of those from the people who are watching. Greg asked, do we know anything about the demographics of the new uptick in cases? Who is being hit the hardest by this?
Correct. At this point, in many parts of the United States, including Iowa, young adults are being affected. Fortunately, young adults develop a few symptoms, but they usually don't require hospitalization, which is good news.
Mm-hmm.
The bad news is that young adults are highly social and can pass it on to other young adults.
Mm-hmm.
And so that's what we're seeing at this moment. Young adults. I was a young adult not long ago, and we like to go to bars, go to restaurants, hang out with friends, and socialize.
Mm-hmm.
But the problem is that carries some risk, especially if we socialize indoors. Again, closed bars in a basement, that can be problematic. So that's the demographic that we're seeing. The risk is that those individuals have other relatives. They may have their parents, their grandparents, that if they are in contact, they can acquire the disease, and those individuals can have very serious outcomes. So some people say, well, maybe those people that have high risk should just stay home and let us all party. But it doesn't work that way, because the more people have the disease in the community, the greater the likelihood that in an accident, let's say, the disease will spill to those other groups. Let's say a nursing home, we may say nobody should leave the nursing home, no party for you. But how about the healthcare workers? The healthcare workers are young. When they are off work, they'll go to a restaurant and they can get infected there and bring it back. So our strategy should be solidarity, a pack. We want to reduce the total number of people infected, even if you personally may not have that serious consequences related to the infection. So you do it for yourself. It sucks being sick. Even if you're young, this can be like the flu or worse. But you can pass it on to others, and then it's going to be very painful to see your relatives, older relatives or relatives that have immune suppression of any kind, have to deal with this serious disease.
Yeah, I appreciate you reminding us that, because I know a lot of younger people who have actually said to me, well, if I get it, I'm not going to get that sick. I'm not going to probably be hospitalized. It'll be okay. But the reminder that it's not just about what happens to me, but what could potentially happen to those around me and those I love if I do get the virus. So I really appreciate you reminding us of that.
And I would say, no matter how young you are, there's always the possibility that COVID will make you very sick. There are children and young adults that die from COVID. A woman, I believe she was 19 years of age or so in New York City, required a lung transplant.
Oh, wow.
Her lungs were destroyed because of this disease. Yes, most people will do okay, but don't take that chance. There are things that you can do to hang out with your friends, to socialize, but still minimize the risk of you acquiring it and passing it on to others.
Yeah, absolutely. So Carolyn and Tracy, two people from Facebook, want to know what should people with asthma or other breathing issues do to protect themselves? We know that masks can be difficult for those people to wear. Are face shields a better option?
Absolutely. Absolutely. Any form of face covering is good. Again, also you want to hang out with people that wear face coverings as well. And you should try to, if you're going to socialize with others, do it outdoors. If it's indoors, do it in indoors that are very spacious, very well ventilated, and that the density of people in that room is not that high, that have very few people. So I think that, yeah, those, and that are the same recommendations for everyone. I guess the only difference for people that have asthma or lung disease is that they should shop around for the best alternative for face coverings. But I can assure you there are face coverings for everyone.
Great. Jessica and Jared, another one that multiple people are asking on Facebook is what do you think about traveling right now? Is it safe to vacation? Is it okay to take a road trip? Is it safe to fly? What's your expert opinion on that?
I think flying is probably okay. Airlines and airplanes are designed to have air movement in a way that decreases the risk of transmission. You will want to clean the seat. You will want to do hand hygiene and always have a face covering. I'm not fully familiar, but I would prefer an airline that has a requirement to have a face covering. Now, road trips, if you're in a car with your family, is completely safe. If you're checking into a hotel and go straight to your room, you'll be fine. I don't see that as a big risk. Again, we need to try to continue with our lives, but safely. But if you're gonna go vacation, go to Destin and party all night in a big indoors, that could be very problematic. So wherever you go, try to choose outdoor activities, do frequent hand hygiene, carry your face coverings with you, maintain some distance from people, and following those simple steps, you can still enjoy your vacation.
Yeah, so I think you're making it really clear over and over again that we still can have summer, we still can have our lives. We just have to make these small accommodations to keep everyone safe and keep our sanity at the same time. Correct. By getting out and doing those things we usually do.
Correct, absolutely.
So the pandemic has required a lot of changes from people, like we've been talking about, just these little changes that we make in our lives. But do you have any advice for how to make these changes more normal? You've already said maybe keep a face mask in your pocket or in your car, but do you have any other tips on how to just make this a thing we're used to doing?
Yeah, no, that's very interesting. I tend to forget all the time. That's why I just have one everywhere. The other thing is for my face shield, I use it all day at work. So again, I take it with me to my car and I leave it in my car. So in the morning, I don't have to think about it. It's there. I put it on. So there is that. Yeah, I don't know. I mean, some people have reminders in their cell phones, checklists. They write it on the wall, in the mirror, in the restroom. Everybody has a way to remember how to do these things, but I don't think this is that complex. This is really all about wanting to do it. If you want to do it, you'll find a way.
That's a good point. Like you said, it's all of our responsibility to play a part in this, and we all do play a part. So we need to do what we can.
Absolutely.
So Mary from Facebook asks, I hear many people talking about herd immunity, which can happen with some viruses and illnesses. Is COVID-19 differently, and is it possible for us to have herd immunity at this point?
We are far from herd immunity. Yes, herd immunity is a possibility. Once a large proportion of a given population has been infected, they may have antibodies, and that may prevent others that may not have antibodies from getting sick. for a virus as contagious as SARS-CoV-2 or the one that causes COVID-19, you may need 60 to 80% of the population having been infected. Just as a comparison, New York City, that is the town that has been the most affected in the United States, probably reached a 20% of the population being infected. So even a place that was nearly devastated by this epidemic is far from herd immunity. Iowa is, again, far from it. I don't have official numbers as to the seroprevalence of COVID-19 in Iowa, but I would imagine that it's much lower than New York City. So if they are far, we are farther from herd immunity. But there is a way to achieve herd immunity without all of us getting sick, and that is once a vaccine becomes available, to get it. I'll be first in line. A vaccine can be very effective. We have vaccines for many diseases. So I'm very hopeful that we will have a vaccine, even if we have to take it once a year, like influenza. I'll take it twice a year. If that would allow us to go back to work, go back to our lives, travel, visit our families. Absolutely. Small sacrifices for the bigger picture, right?
Yeah, great point. Well, you kind of touched on the next question that came from Facebook, which is, if the virus has already been through my area, should I be concerned about the spike in new cases? Since it's already been here once, won't it reach a dead end and just go away? So you already kind of answered that, but could you just elaborate on that a little bit?
Absolutely. Unfortunately, in every town and every county in Iowa, we are far from herd immunity. Yes, we should be concerned, not panic. Sometimes when we panic, we make mistakes. We want to be vigilant. We want to follow our protocols. We've been living with COVID now for a few months. We know what to do. Distancing, hand hygiene, face coverings, avoid parties indoors. You'll be all right. We can do this. Prefer takeout rather than dining in, for example. Yeah, that's what we need to do. Yeah, I think that we can and we will bring these numbers down again, but we just have to all follow these simple steps and we'll get there.
Yeah. Well, Sarah is watching this live on YouTube right now, and she asks, what's the current thinking on whether COVID-19 can exist on surfaces? Should we still avoid playgrounds and other things that like kids really want to go do?
Absolutely. Yes, this is affecting children's lives tremendously. Yes, the virus can live on surfaces. Recently, CDC put a statement saying that perhaps surfaces play a lesser role than previously thought, but it's still possible. If somebody coughs or speaks, droplets can travel and fall onto surfaces. Again, the great thing is that outdoor surfaces, because of ultraviolet light from the sun and heat, etc., inactivate those forces, inactivate the virus much quicker than indoors. Yet another advantage of going outdoors. So if you go to a playground, if you do it early in the day, and if you can clean it, let's say, or clean a few of the surfaces, it's probably okay. But probably from one day to the other, even if there was a child with virus, probably by the next day, the virus is dead, is not infectious. And after children play, hand hygiene, ask them to not touch their face. And I think that it can be done.
I think you just made thousands of parents across the United States super happy with that statement, that they can take their kids to parks.
Correct. Yes, I think that we can take kids to parks. Now, if the park has 1,000 people that were very happy because of that previous statement, it becomes a problem again.
Sure.
Assuming that it's not very crowded, I think that it's a calculated risk. I think I would do it. My children have been to a playground already.
Oh, that's so good to know. I took my daughter the other day. It was her birthday, and all she wanted to do was go to the park. And so my husband and I were really careful, and we made sure she didn't touch her face. And then we had hand sanitizer in our pocket for just frequent hand hygiene. And it ended up being fine. There were no other kids there that day, and so I felt pretty safe doing it. But I'm glad someone asked that online, because I was curious about that as well as a parent. So we've seen comments around social media, and maybe you have too, Dr. Salinas, that it's people's personal rights not to wear any kind of face coverings, or they don't have to stay at home. Kind of the whole, like, they don't want to listen to authority. Maybe a little bit of that, of like, well, you're telling me not to, so I'm going to do it anyways. What's your kind of reaction to those statements?
So I've traveled to several countries in the world, and Iowans are the most respectful people that I've met. The most respectful, the more courteous. So do it for yourself, for your safety, but do it also for others. Again, Iowans are the best. We're very respectful. Do it for others. This is not an infringement in your liberty. The problem is that if there is a lot of transmission of COVID, if we don't stop it with these simple steps, then the restrictions to our freedoms are much higher. Another shutdown, closing all businesses, etc. So again, it's like a little vaccine. Yes, it hurts some, but it prevents you from getting very sick, having to go into the hospital, potentially dying. I'll take the little pain. It's the same thing. Yes, it's a bit uncomfortable. The good thing, again, there are many kinds of face coverings. We're giving tips on how to socialize safely outdoors as much as possible. So if you want to throw a party, do it in your backyard, or try to do it outdoors. If the restaurant you go to, the bar you go to, has a patio and it's not that crowded, that's the place to go, rather than going to an indoor bar that is crowded with a bunch of people. So there are ways to accomplish this without affecting our liberties that much. And that way we will all live long, happy lives.
Yeah, this won't last forever. It feels like it sometimes, but it won't.
Correct.
So at the beginning of the pandemic, there was this sense of urgency to stay home and keep others protected, especially our healthcare workers. But now that states have begun to reopen, there's a little less of that urgency. Can you just reiterate why it's so important for people to continue that, maybe not staying at home, but just that urgency to protect others?
Correct. By protecting others, you're protecting yourself, you're protecting your family. If you can stay at home, do so. I still try to limit my trips, let's say to the convenience store or wherever I have to buy my groceries. I go once a week, for example. I do it for my family. So try to limit that. But sometimes, again, long ago when I was younger, I wanted to hang out with friends, etc. So it's okay if you can do it. Try to hang out with a close group of friends. Do it outdoors. It can be done.
Great. So in other countries, we've seen a peak in COVID-19 numbers and then a steady decline. But in many places throughout our country, including Iowa, we haven't seen that same kind of decline. Can you explain that to our audience?
Yes, the epidemiology of COVID varies tremendously by country, by location. But consistently, the places that have implemented solid science-based public health measures have been able to reduce the number of cases. But it's difficult. It's science, but it's an art, and sometimes some places will overshoot, will hunker down, and very little will happen, and then they reopen, and then COVID comes. And then you have to hunker down again. So it's going to be these ups and downs for the foreseeable future. So I think that if we all practice these safe steps to responsibly socialize, we will be able to avoid these abrupt increases and decreases. So it can be, we can keep it down keep the rates down at a very tolerable rate. which should be, very low.
Yeah.
So yes, there are a lot of things we're learning. This is a brand new virus, and our state was not uh, affected at the same time as other states. So we have opportunities to learn from the experiences of other states, even if the government or if the state doesn't necessarily mandate certain things, we can still do them. We can still wear a face covering. We can still try to limit our visits to the stores and to parties. We can prefer to eat or socialize outdoors versus indoors.
Great. So one more question from Facebook is Brenda asks, can you give any advice on how to safely socialize toddlers and young kids so that they're getting interactions with others, but maybe they won't keep a mask on or they won't wear a shield? What are your recommendations for making sure that kids still get that interaction with other kids during this time?
Absolutely. I mean, there are several things. For once, you can still use technology, Zoom or Skype or video calls. You can do that to socialize with children in other towns even.
Mm-hmm.
But it's also good to, again, as that concept of the social bubbles, a small group of maybe 2 or 3 families that you guys decide to follow similar protections. And I think it would be okay for children to socialize there. I would still try to do it outdoors as much as possible. Frequent hand hygiene. Again, what our game is to try to reduce the risk, so we can try to continue having as normal a life as possible.
Sure. So I know with my 3-year-old, she will wear a mask or a shield, but she had to see my husband and I wearing ours first. And she consistently saw me leaving to go get groceries with my mask and then with my shield when I bought that. And it just became a thing that she expected. And now if we leave the house, I don't even have her go into the store with me, but she goes, my shield. So do you have any tips on just getting kids to be comfortable with them? Because this is new for them too.
I think that perhaps having designs in the masks or shields, you can put stickers on shields, and you're a superhero.
Yeah.
Yes, you can. I'm not sure if this term exists, but gamify. Make it a game.
Oh, sure.
Make it a game, and we're all superheroes. Hey, we're gonna put our face coverings, our masks, protect our identities, and I think that may work. But every family is different. Have their own tricks to make their children do what you want them to do. If you discover how to make them eat their dinner, please let me know.
Please let me know too. Well, before we sign off, I just want to have you, for people who maybe tuned in later and didn't hear you earlier in the broadcast, I would love if you could just real quick go over the prevention measures again, all the things we can each do to stay safe and keep others safe.
Absolutely. So as much as possible, let's try to maintain 6 feet of distance from one person to the other. Let's do frequent hand hygiene. Let's have a face covering every time that we're going to be near others. For example, when going to stores, at work. If you're going to socialize in a bar or a restaurant, prefer those that have outdoor seating. Mm-hmm. The number of air exchanges is so much superior outdoors that decreases the risk of transmission of COVID tremendously. So if you follow those things, if you want to do a party, try to do it in your backyard rather than indoors, etc. And I think that following those steps, we can continue socializing while maintaining our sanity, as you put it earlier.
Yeah. Great. Well, thank you for that wrap up, and thank you so much for sharing all of your expertise with us today, Dr. Salinas.
Absolutely. Anytime.
And thank you for everyone who tuned in. If you joined us after we started, make sure to go back and watch the whole broadcast because Dr. Salinas really provided us with some great information. And make sure to follow our social media accounts and visit our website, uihc.org, for all the latest updates on COVID-19 as we have them. Lastly, please remember to cover your face in public, wash your hands often, and take care of yourself, your family, and your health. Thanks for watching.